Question 1. A post-operative client reports severe abdominal pain and restlessness. Which action should the nurse take first? A. Administer prescribed PRN opioid analgesic. B. Assess the client's vital signs and abdominal incision. C. Notify the healthcare provider immediately. D. Offer emotional support and reassurance. Answer. B. Assess the client's vital signs and abdominal incision. Question 2. Which task can the RN delegate to a UAP when caring for a client with acute pain? A. Perform pain assessment. B. Teach the client about PCA pump use. C. Report nonverbal signs of pain to the nurse. D. Adjust opioid dosage per protocol. Answer. C. Report nonverbal signs of pain to the nurse. Question 3. A client reports 9-10 pain after morphine administration. What is the nurse's priority action? A. Re-administer morphine immediately. B. Reassess pain in 30 minutes. C. Notify the provider for inadequate pain relief. D. Document the client's complaint. Answer. C. Notify the provider for inadequate pain relief. Question 4. Which statement by a client receiving 4 opioids requires immediate follow-up? A. I feel itchy around my neck. B. My pain is now 4 out of 10. C. I feel very sleepy and can't keep my eyes open. D. I haven't had a bowel movement in 2 days. Answer. C. I feel very sleepy and can't keep my eyes open. Question 5. When assigning a client with acute post-op pain, which nurse is best suited for care? A. A float nurse from pediatrics. B. A new graduate nurse orienting on the unit. C. An experienced RN from the surgical floor. D. An LPN familiar with the unit. Answer. C. An experienced RN from the surgical floor. Question 6. A client's family asks why the client appears sedated after pain meds. What is the best response? A. Pain meds cause drowsiness, which is normal. B. Your family member is sleeping deeply and comfortably. C. Let's evaluate the client's sedation and breathing right now. D. We gave a higher dose to control the pain. Answer. C. Let's evaluate the client's sedation and breathing right now. Question 7. A nurse assigns an LPN to care for a client with acute back pain. Which task is appropriate? A. Assessing pain characteristics. B. Initiating morphine PCA. C. Administering oral analgesics. D. Evaluating effectiveness of treatment. Answer. C. Administering oral analgesics. Question 8. Which client should the nurse see first? A. Client with mild pain rating 3 out of 10. B. Client who received opioids and is difficult to arouse. C. Client requesting pain medication for a headache. D. Client resting quietly with PCA in place. Answer. B. Client who received opioids and is difficult to arouse. Question 9. A client with chest pain receives morphine. What is the most important assessment after administration? A. Pain relief level. B. Respiratory rate. C. Oxygen saturation. D. Level of sedation. Answer. B. Respiratory rate. Question 10. What is the most effective non-pharmacological strategy to support a client in acute pain? A. Encouraging early ambulation. B. Applying a warm compress as ordered. C. Offering a full liquid diet. D. Providing high-frequency massages. Answer. B. Applying a warm compress as ordered. Question 11. A client reports pain as burning and shooting down the leg. What type of pain is this? A. Somatic pain. B. Visceral pain. C. Neuropathic pain. D. Psychogenic pain. Answer. C. Neuropathic pain. Question 12. Which action should the nurse take when a client refuses opioid pain medication? A. Document the refusal and notify the provider. B. Discard the medication immediately. C. Insist the client take the medication. D. Offer a sedative instead. Answer. A. Document the refusal and notify the provider. Question 13. Which client behavior indicates effective pain management? A. Sleeps intermittently through the night. B. Eats 50% of meals and watches TV. C. Frequently grimaces when moving. D. Refuses to participate in physical therapy. Answer. B. Eats 50% of meals and watches TV. Question 14. What is the nurse's priority when managing a client with acute abdominal pain and low blood pressure? A. Encourage deep breathing exercises. B. Administer PRN pain medication. C. Delay opioids until hypotension resolves. D. Assess for signs of internal bleeding. Answer. D. Assess for signs of internal bleeding. Question 15. Which pain-related task is most appropriate to delegate to an LPN? A. Initial pain assessment. B. Titrating opioid dosages. C. Reassessing pain after oral analgesics. D. Teaching pain management techniques. Answer. C. Reassessing pain after oral analgesics. Question 16. A client with acute pancreatitis reports worsening pain. What should the nurse do first? A. Notify the healthcare provider. B. Review latest lab results. C. Reassess the client and vital signs. D. Administer a stronger analgesic. Answer. C. Reassess the client and vital signs. Question 17. The nurse prepares to administer for morphine. What is the best way to promote client safety? A. Monitor oxygen saturation post-dose. B. Have the client void before medication. C. Instruct the client not to eat for 2 hours. D. Reposition the client after injection. Answer. A. Monitor oxygen saturation post-dose. Question 18. Which client statement indicates a need for more teaching about PCA? A. I can press the button when I feel pain. B. I might get sleepy from this medication. C. My family can press the button when I'm asleep. D. There's a limit on how much medication I can get. Answer. C. My family can press the button when I'm asleep. Question 19. What is a critical safety concern when using opioid analgesia in elderly clients? A. Hypoglycemia. B. Respiratory depression. C. Hyperkalemia. D. Nausea and vomiting. Answer. B. Respiratory depression. Question 20. A nurse is caring for 4 clients. Which client should be assessed first? A. A post-op client reporting pain 5/10. B. A client who received 4 opioids 20 minutes ago and is drowsy. C. A client asking for medication education. D. A client requesting help ambulating to the bathroom. Answer. B. A client who received 4 opioids 20 minutes ago and is drowsy. Question 21. A client with rib fractures reports severe pain while breathing. What is the priority nursing intervention? A. Encourage deep breathing despite pain. B. Administer prescribed analgesic before respiratory therapy. C. Apply heat packs to the chest. D. Limit movement to prevent further pain. Answer. B. Administer prescribed analgesic before respiratory therapy. Question 22. A nurse caring for a client with acute sickle cell crisis should anticipate which priority intervention? A. Provide high-protein diet. B. Encourage ambulation. C. Administer 4 fluids and analgesics. D. Apply cold compresses to joints. Answer. C. Administer 4 fluids and analgesics. Question 23. A nurse is evaluating pain control in a nonverbal client. Which assessment tool is most appropriate? A. Faces scale. B. Flack scale. C. Numeric rating scale. D. Visual analog scale. Answer: B. Flack scale. Question 24. A client post-hip replacement requests pain medication. Which statement by the nurse ensures safe administration? A. Let me see if your prescription allows more medication. B. You already had pain medicine recently. C. I'll assess your pain and vital signs first. D. Try repositioning first, then we'll medicate. Answer: C. I'll assess your pain and vital signs first. Question 25. Which of the following actions can a nurse delegate to a UAP caring for a client in acute pain? A. Administer non-prescription analgesics. B. Evaluate the client's pain relief. C. Monitor for side effects of opioids. D. Report observed changes in behavior. Answer: D. Report observed changes in behavior. Question 26. What is the nurse's best action when a client reports unrelieved pain after medication? A. Inform the client that the medication needs more time. B. Contact the provider for reassessment and possible change in orders. C. Offer distraction techniques. D. Reassure the client pain will subside soon. Answer: B. Contact the provider for reassessment and possible change in orders. Question 27. A client is prescribed a transdermal fentanyl patch. What is a key nursing consideration? A. Apply patch to an open wound. B. Use the same site for each application. C. Avoid heat sources near the patch. D. Remove patch after 12 hours. Answer: C. Avoid heat sources near the patch. Question 28. A client complains of severe pain and swelling in the leg post-operatively. What should the nurse assess next? A. Bowel sounds. B. Pedal pulses and temperature. C. Lung sounds. D. Blood glucose level. Answer: B. Pedal pulses and temperature. Question 29. A nurse teaches a client about using the pain scale. Which statement indicates understanding? A. I should only report pain above 7. B. I will report any discomfort using the scale. C. Pain below 5 doesn't require medication. D. I will wait until pain is unbearable before asking. Answer: B. I will report any discomfort using the scale. Question 30. What is the nurse's priority assessment before administering morphine to a client in pain? A. Blood pressure. B. Heart rate. C. Respiratory rate. D. Temperature. Answer: C. Respiratory rate. Question 31. Which finding in a client taking opioids should prompt the nurse to notify the provider immediately? A. Constipation. B. Itching. C. Respiratory rate of 8. D. Drowsiness. Answer: C. Respiratory rate of 8. Question 32. A client in acute pain refuses analgesics due to fear of addiction. What is the nurse's best response? A. Pain medication is necessary regardless of concerns. B. Addiction is not a concern in the hospital. C. Let me explain how we safely manage your pain. D. We can use only non-drug methods instead. Answer: C. Let me explain how we safely manage your pain. Question 33. What is the most appropriate action when a client reports worsening pain post-surgery? A. Offer emotional support. B. Reassess the surgical site and vital signs. C. Encourage more activity to prevent stiffness. D. Tell the client it is normal after surgery. Answer: B. Reassess the surgical site and vital signs. Question 34. Which of the following is a priority teaching point for a client prescribed NSAIDs for acute pain? A. Take on an empty stomach. B. Avoid alcohol while using this medication. C. Expect urine to become dark. D. Use heat therapy with every dose. Answer: B. Avoid alcohol while using this medication. Question 35. A client with an abdominal wound is grimacing but denies pain. What should the nurse do first? A. Respect the client's report and document it. B. Assume the client is minimizing pain and medicate. C. Perform a focused pain assessment. D. Notify the provider immediately. Answer: C. Perform a focused pain assessment. Question 36. A client is receiving 4 morphine for post-op pain. Which intervention is essential? A. Encourage fluid intake. B. Monitor urinary output. C. Maintain bed in high Fowler's position. D. Count respirations regularly. Answer: D. Count respirations regularly. Question 37. What is the most appropriate nursing diagnosis for a client with acute pain? A. Risk for falls. B. Ineffective coping. C. Acute pain related to tissue injury. D. Impaired skin integrity. Answer: C. Acute pain related to tissue injury. Question 38. Which instruction is most important for a client discharged with opioid pain medication? A. You can drive once pain improves. B. Take medication only when pain is severe. C. Store medication in a locked location. D. Stop taking it once you feel better. Answer: C. Store medication in a locked location. Question 39. The nurse assigns a client with acute pain to an LPN. Which task should remain with the RN? A. Administering oral pain meds. B. Performing the initial pain assessment. C. Repositioning the client for comfort. D. Documenting pain score. Answer: B. Performing the initial pain assessment. Question 40. A client using PCA reports no relief despite pressing the button. What should the nurse do first? A. Explain that the dose may not be enough. B. Reassure the client the pain will resolve. C. Check the PCA settings and functioning. D. Contact the provider to increase dose. Answer: C. Check the PCA settings and functioning. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.